All right, welcome back to the deep dive. You know we always say stay hydrated, but have you ever thought about what happens when that balance gets thrown off?
Yeah, it can get pretty serious.
I mean, really seriously, you sent us some material on fluid shifts,
Oh, yeah.
specifically ascites and pleural effusion, and let me tell you, it's a lot more complicated and honestly way more fascinating than I expected.
It really is, and it's not just uncomfortable. It can really impact your whole body, especially your electrolytes.
You know, we always think about electrolytes in sports drinks,
Right? Right.
but they're vital for your nerves to send signals and for your muscles to contract. It's like it really is your body's electrical system.
Yeah, it's a good analogy.
And if those electrolytes are out of whack, things can start misfiring.
For sure.
So let's dive right into these specific conditions, starting with ascites.
Okay.
So it's basically when fluid builds up in your abdomen or around your organs.
Exactly. And not just like a little bloating after a big meal. We're talking serious fluid. It can cause discomfort, pressure, and even make it hard to breathe.
Now, the sources you sent in mention cirrhosis as a major cause of ascites.
Right?
And you know that scarring of the liver, often from long-term alcohol abuse. But other conditions can contribute too.
Absolutely.
It's fascinating how that scarring disrupts the normal flow of fluids and then leads to the buildup in the abdomen.
It's almost like a traffic jam in your circulatory system.
Yeah.
And the backup doesn't just cause discomfort, it really messes with your electrolytes.
Uh-oh.
For example, it can lead to hyponatremia,
Hyponatremia now, is that?
low sodium.
Okay, low sodium. And this is where I get really concerned because if that's not treated, low sodium can actually lead to seizures.
Absolutely. Sodium is crucial for nerve function, and when the levels get too low, it can really disrupt brain activity.
Wow.
And it's not just sodium. Ascites can also lead to hypokalemia, which is low potassium. That affects muscle function and heart rhythm.
So we're seeing how these fluid shifts can actually impact other systems in the body.
Big time.
Now, the sources also mention hypoalbuminemia.
Right.
Now, that's low levels of a protein called albumin. Now, instead of saying, it leads to problems, maybe you can explain how that actually affects fluid movement.
Sure. Albumin is really important because it maintains osmotic pressure.
Osmotic pressure.
Yeah, think of it like a magnet that helps keep fluid in the right places.
Okay.
So when albumin levels are low, fluid can leak out of blood vessels into surrounding tissues,
Oh.
and that causes swelling.
So ascites is definitely not something to ignore.
No.
Let's move on to the second type of fluid shift you sent us material about, pleural effusion.
Oh, yeah.
With so many potential causes, how do doctors even begin to unravel what's behind these fluid shifts? It seems like a real detective job.
It is a bit of a detective job. So
Yeah.
pleural effusion is a buildup of fluid around the lungs
Okay.
in that space called the pleural cavity. And as you can imagine, having your lungs essentially squeezed by fluid can make breathing really difficult.
Oh, I'm getting anxious just talking about it.
Yeah.
I remember I had pneumonia once, and even that was bad enough. Could a simple lung infection really lead to this?
It can.
Mm.
Pneumonia, whether it's caused by a bacteria or a virus, causes inflammation in the lungs.
Right.
And that inflammation can trigger fluid buildup in the pleural space.
Wow.
And remember, the body is a complex system, so if one part isn't working properly, it can trigger problems in other areas. Congestive heart failure, where the heart isn't pumping blood effectively, can also lead to fluid backing up in the lungs.
It's like a domino effect.
It is.
One thing leads to another, and suddenly you have this potentially serious condition.
Yeah.
The material also mentioned pulmonary embolisms, which are blood clots in the lungs, and then, of course, cancer.
Right.
It seems like these fluid shifts are often symptoms of a larger problem.
You're exactly right. Just like ascites, pleural effusion is often a red flag that something else is going on. And just like with ascites, it can have a significant impact on electrolytes, especially albumin. You see, albumin isn't just about regulating fluid balance, it's also vital for transporting nutrients and hormones. And it plays a crucial role in our immune system and wound healing.
So having low albumin levels means you're more susceptible to infections and your body can't heal as quickly.
That's right.
It seems like getting enough protein is crucial, not just for building muscles, but for maintaining this really delicate fluid balance.
Exactly. That interconnectedness is fascinating, but it also makes diagnosis and treatment a real challenge.
Absolutely. So now that we've laid the groundwork, let's take a closer look at how doctors diagnose and manage these conditions. What tools do they use to unravel this mystery?
What starts with a thorough physical exam, They'll listen to your lungs, check for swelling, ask about your symptoms. But to really see what's going on inside, they'll often use imaging techniques
Okay.
like ultrasounds or CT scans.
So a CT scan, that's kind of like an X-ray, but much more detailed, right?
Exactly. It gives them a 3D view of what's happening in your chest or abdomen.
Okay.
And they might also take a sample of the fluid itself
Oh, wow.
to analyze it.
Interesting.
This can help them identify the presence of infection, inflammation, or even cancer cells.
So it's like putting together a puzzle.
Yeah,
They're using all these different pieces of information to get a complete picture of what's causing the fluid buildup.
exactly.
So they've done their detective work and they have a diagnosis. What happens next? What kind of treatment options are available?
Well, as you might imagine, one common approach is to drain the excess fluid.
Hmm.
For ascites, they use a procedure called paracentesis,
Paracentesis, okay.
where they insert a needle into the abdomen to drain the fluid.
Paracentesis. That sounds intense. Is it painful?
It can be a little uncomfortable, but they typically use local anesthetic to numb the area,
Okay.
and the relief from the pressure and discomfort can be significant. Plus, it allows them to analyze the fluid more closely, which can be helpful for guiding further treatment.
So it's not just about getting rid of the fluid, it's also a diagnostic tool.
Exactly.
Now, what about pleural effusion? Do they drain the fluid from around the lungs as well?
They do, and the procedure is similar, but it's called thoracentesis because it involves inserting a needle into the chest cavity.
Okay.
Again, it can provide relief from the symptoms and help them get a better look at the fluid itself.
So draining the fluid offers relief, but it's only treating the symptom, not the source.
Right.
Let's talk about how doctors uncover the root causes of these fluid shifts and what they can do to address those underlying issues.
You're absolutely right. Treating the fluid buildup is like trying to put out a fire by only dealing with the flames.
Right.
You have to extinguish the source.
Yeah.
And that's where treating the underlying cause comes in.
Okay.
If it's an infection, they'll need to treat that with antibiotics.
I got it.
If it's heart problems, they'll focus on managing those. If a tumor is causing the problem, they might need to do surgery or other treatments to address that.
So it sounds like there's a whole arsenal of treatments available depending on the specific cause. What about managing those electrolyte imbalances we talked about?
Right.
It seems like getting those levels back on track is crucial for recovery.
Absolutely. And there are a few approaches they can take. One is dietary adjustments,
Okay.
particularly increasing protein intake to boost those albumin levels. They might also recommend electrolyte supplements, either taken orally or given intravenously.
Interesting.
And regular blood tests are essential to monitor electrolyte levels and make adjustments as needed.
So it's a multi-pronged approach.
Yes.
Deal with the fluid, address the root cause, and then fine-tune those electrolyte levels. It sounds like a lot to manage, but with the right care, people can recover and go on to live healthy lives, right?
Absolutely. And what's really cool is that the source material you provided ended with a test your knowledge prompt,
Oh, nice.
suggesting that you now have the foundation to explore further on your own, if you're curious.
That's fantastic. You came to us wanting to understand fluid shifts and electrolytes, and now you're equipped to keep learning and digging deeper if you want.
It's all about empowering ourselves with knowledge.
Exactly. We've covered a lot of ground here. We've gone from stay hydrated to a whole new understanding of how fluids and electrolytes work together and what happens when those systems get disrupted.
And we've only just scratched the surface. There's so much more to learn about these intricate processes within the body. But before we get too carried away, let's take a moment to recap the key takeaways from this deep dive into fluid shifts and electrolytes. We'll be right back.
And we're back. And, even for me, someone who loves learning new things, this deep dive has been full of surprises. We've talked about these two conditions, ascites and pleural effusion, and how they're not just about too much fluid, but about this delicate balance of electrolytes being disrupted.
Yeah, it's a good reminder that our bodies are incredible, these intricate systems. And when something goes wrong, it can often set off this chain reaction. So let's recap what we've learned. What are the key takeaways you found most impactful?
Well, for me, it's that ascites and pleural effusion are like red flags, signals that something deeper is going on. We tend to think of fluid buildup as a problem in itself, but it's really a symptom.
Yeah, exactly. Ascites could be a sign of liver disease or heart failure, kidney problems, or even cancer.
Mm.
And pleural effusion can be triggered by infections like pneumonia, heart issues, blood clots, or also cancer.
So step one is like this detective work, figuring out what's causing the fluid to accumulate in the first place.
Right.
And that's where those diagnostic tools we talked about come in. The
Mm.
physical exams, imaging like ultrasounds or CT scans, even analyzing a sample of the fluid itself.
Yeah, it's like piecing together a complex puzzle, isn't it?
It is.
And the pieces aren't just about where the fluid is, but what's in it and how that points to the root cause.
Yeah.
Yeah, that brings me to another key takeaway, the impact on electrolytes.
Right.
It's not just about feeling thirsty or dehydrated, it's about these vital minerals being thrown off balance, and that can have some serious consequences.
Absolutely. We were talking about how ascites can lead to low sodium levels or hyponatremia,
Right.
which can cause confusion, weakness, and even seizures.
Yeah.
And it can also affect potassium levels, which affects muscle function and heart rhythm.
And then there's hypoalbuminemia, low
Mm.
levels of that protein, albumin. I was surprised by just how much albumin does in the body. It's not just about fluid balance. It affects our immune system, wound healing, even how nutrients get transported.
Yeah, it's like albumin is this behind-the-scenes hero. It's working tirelessly to keep everything running smoothly, and when its levels drop, the effects can be widespread.
So we've got the fluid buildup, we've got the electrolyte imbalances. It all feels very interconnected, and treatment needs to address both, right?
Yeah.
Draining the fluid is important for relief, but it's not the whole solution.
You've hit on a crucial point. Just like putting out a fire, you have to deal with the source, not just the flames.
Right.
Treating the fluid buildup is like addressing the flames.
Yeah.
But finding and addressing the underlying cause is like extinguishing the source of the fire.
It's a two-pronged approach then. Manage the fluid A&D, tackle the root cause, whether it's an infection, heart problems, or something else entirely. What I found especially intriguing was the variety of treatment options available.
Yeah, the source material that you provided covered a range of approaches, from lifestyle modifications and dietary adjustments to medications like diuretics, and even procedures like paracentesis or thoracentesis to drain the fluid directly.
And of course, there's managing those electrolyte imbalances, which can involve increasing protein intake, taking supplements, and regular monitoring through blood tests. It sounds like a complex balancing act.
It is. But with careful management, people can recover and go on to live healthy lives. And what's inspiring is that you, the listener, now have a solid foundation to explore further on your own. Remember that test your knowledge prompt at the end of the source material. Now you have the knowledge to tackle those questions and really dig deeper into this fascinating world of fluids and electrolytes.
It's amazing how much we've learned from a seemingly simple question about fluid shifts. We've uncovered this whole network of interconnected systems and processes that are essential for our well-being.
It's a testament to the power of curiosity and the joy of discovery, and this deep dive has really highlighted how much we can learn when we take the time to really explore, like, beneath the surface.
You know, we've covered a lot of ground, but before we wrap things up, I think it's important to leave our listeners with something to ponder, a final provocative thought to spark their continued curiosity about this topic. What question or idea do you think would be most intriguing for them to consider?
That's a great point. We've focused on the negative aspects of fluid shifts, but what about the flip side? What are some of the everyday things that we can do to support our body's natural fluid balance and electrolyte harmony? That's something I think would be worth exploring further.
That's a fantastic question. We've learned about what happens when things go wrong, but now it's time to think about how we can proactively maintain that delicate balance. It's all about being informed and empowered to take charge of our health. So on that note, let's wrap up this episode of The Deep Dive. Wow, we've really journeyed deep into this world of fluid shifts and electrolytes, from albumin's behind-the-scenes role to realizing these conditions are like warning lights. It's been quite a ride.
It really has, and it all started with your curiosity. This whole deep dive started because you wanted to understand these complex systems, and now you have a foundation of knowledge to build on.
That's what I love about these deep dives. You start with a question, we explore, and we end up with not just answers, but a deeper understanding of ourselves and the world around us.
It's true. It's like peeling back a layer and seeing this whole hidden world of intricate processes that are happening inside us all the time.
And they're vital. We've seen how disruptions in fluid balance and electrolyte levels can have like these cascading effects throughout the body. It's not just about, feeling thirsty or bloated. It's about the potential for serious complications if those imbalances aren't addressed.
Exactly. Ascites and pleural effusion, they're not just conditions to be managed. They're really opportunities to pay attention to our bodies and seek the care we need.
So if there's one thing I want you to take away from this deep dive, it's to listen to your body.
Yeah.
If you're experiencing any of those symptoms we've discussed,
Hmm.
persistent bloating, difficulty breathing, chest pain, don't ignore them. Talk to your doctor.
Definitely.
Mm.
Early diagnosis is key. The sooner the underlying causes are identified and addressed, the better the chances are for a full recovery. And it's not just about treating those symptoms. It's about restoring that balance of fluids and electrolytes that keeps our bodies working at their best.
Absolutely. And we've talked about diet, especially getting enough protein
Right.
to support those albumin levels.
Brown.
And medications, procedures, it's a real team effort between you and your healthcare provider.
Is. And knowledge is power in that effort.
Mm.
The more you understand about how your body works, the more empowered you are to make informed decisions about your health.
And that's what the deep dive is all about, empowering you with knowledge, sparking your curiosity, and encouraging you to keep exploring.
Definitely.
We've only just scratched the surface of this topic, and there's a whole world of knowledge out there waiting to be discovered.
So remember that test your knowledge prompt from the source material. Well, now you're equipped to tackle those questions and delve even deeper. Who knows what other fascinating insights await you?
This deep dive might be over, but your journey of discovery continues. Keep asking questions, keep learning, and keep exploring the wonders of your own amazing body. Until next time, stay curious.
You've been listening to the Learning Podcast, a production of Metanesta. Remember, learning is a journey. One step, one insight, one skill at a time. We'll see you next time. Keep learning, stay curious, and as always, be awesome.